It's time for Healthy Families with Omni Family Health. Dental health is very important for pregnant women, so we have Jenee Newman here on behalf of Omni Health to share more. Thank you for joining us today.
Thank you for having me.
So tell us, how important is it for pregnant women to have a dental exam?
It's so very important, 10 out of 10 important. When we don't take care of ourselves, it's very difficult to take care of anyone else very well. So it kind of starts there.
Yeah, well, and I feel like especially during a pregnancy, there's so many things going on, and I feel like you wouldn't really think much about your teeth.
Exactly, you're worried about so many other things, and we can just kind of forget about how important our teeth are.
So are pregnant women, do they have a higher risk for cavities or dental issues?
Absolutely. There's two diseases in the mouth. There's cavities, and then there's gum disease, and they're more at risk for both of those. Cavities, they're more at risk because certainly their dietary, how their eating changes, and so when you have more sugars, you're going to have more cavities, and it's going to weaken your enamel. And then in the same way, gum diseases, you're also more susceptible to that one because you're more susceptible to the bacteria getting into your gums, and then that bacteria then goes down to your jugular veins here and then directly to your heart and everywhere else.
Well, and I feel like too, I mean, I'm sure some women have different cravings. I know my mom's cravings were spaghetti and watermelon, but if you happen to have a super sweet tooth during pregnancy, I feel like that could affect things maybe.
Yeah, I was on Klondike bars.
And obviously getting dental work done while pregnant is safe.
It's absolutely safe. There's no risks involved. In 2014, the ADA and the American Academy of Obstetricians and Gynecologists issued a joint statement saying there was no risk, and in fact, there's more risk to not getting treatment. That includes root canals, cavities, deep cleanings, all those things are safe to do.
Well, of course, throughout the entire pregnancy, we're always thinking about babies. So are there special risks that can be passed down through like your oral health down to the baby?
Absolutely. It's very important. So gum disease, the disease I mentioned earlier, is the bacteria, well, like I said, transfers. It migrates through your body and it can rupture the placenta, and thus causing low birth weight and preterm babies. And additionally, the other thing that it causes when we don't get dental treatment is, say I have a cavity. Well, now, that cavity is just a bacteria. It's a pool of bacteria living inside of a tooth. Now the baby's born and I kiss my child. That child now has that bacteria and is 3 times more likely to have a cavity before they're 5 years old.
Wow, I've never even thought of this. This is blowing my mind.
And it's so sad. If you've ever seen a child at a dentist, none of us enjoy it, and it's especially sad to see a child having to go through like a dental filling, and at a young age, it really can make them scared of the dentist forever. So it's much better for all of us and for every mom to take care of it now and lessen that risk for them later.
And so what are some of these tips for oral health for moms?
Okay. Number 1, please see your dentist. Complete all your dental treatment prior to delivery. That way you know that your bacteria is low and you have less of a chance of transferring it to them. And then if you're experiencing morning sickness, actually don't brush after, because when we get sick, that weakens the enamel. It's an acid and it breaks down the enamel and actually makes it softer. So the best thing to do is rinse with water, and you can put a little baking soda in the water to bring the mouth back to a basic environment, not acidic. And then of course brush and floss.
Yeah, great tips. Thank you for that. And tell us what services Omni Health offers for pregnant women in the oral health area.
Well, pregnant ladies get the VIP treatment. We understand there's so many barriers to care, and there's so many things that a pregnant woman has to plan for, that at Omni we offer priority scheduling. So they'll get fast-tracked to the dental office and on to getting to complete what they need to do.
That's good to know, because yeah, like you said, it's better to get the work done before you have the baby.
Yes, can you imagine going to the dentist and you have no?
Yeah. Well, thank you for all this information. What's the best way for people to reach out to schedule an appointment?
You can go to our website, you can call our phone number, you'll get an appointment within a few weeks.
Awesome, so good to know. Thank you so much for joining us.
Thank you.
We'll be right back after the break.